So what things do you specifically talk to your patients about when they're coming in for preconception counseling?
Sure. Yeah. So, I mean, I tend to break them out in my head thinking about things that are easier to take care of when you're not pregnant. There are certain issues if they come up once you're pregnant. Things are much more complicated. There are, pregnancy is a natural stressor on the body. And so there are things that which might develop in pregnancy, and you might find risk factors that you can work with their referring physician to decrease the risk of those things happening. And then there's things, either lifestyle issues or things that are unsuspected that could lead to issues with a baby developing in pregnancy, and you can find those things and try to mitigate them to minimize the chances of having a baby that's not perfect.
I do something very similar. Wellness exams are something that we talk about at the first visit. While women tend to get used to the rhythm of going in to see their OB/GYN for their pap smear and their breast exam and their mammogram and their discussion of where they are in their annual health, many men don't go to see a doctor unless something is broken or painful. And so to talk about the benefit of a wellness exam with regards to checking blood pressure, looking for diabetes, and just seeing whether things are changing as we age is beneficial. And for women, we can focus on the immunities that they can help within themselves that will then help their baby. So getting your flu shot is important before pregnancy. Checking to see if you're still immune to chickenpox and rubella, those childhood immunizations that we get but that sometimes wear off. And if the immunity is not there, getting it boosted before there is a baby to be protected are things that we discussed.
Yeah, and just things like getting a mammogram and a breast exam in case they find a breast lump. It's a whole lot easier to take care of those things when you're not pregnant than after you've got a baby on board, and the therapy for mom may not jive perfectly with the therapy for the baby.
What are some other pregnancy conditions that you talk to your patients about that might affect the wellness of their child?
Yeah, I think one of the things that young people don't realize is that pregnancy is a natural stressor in the body. That the placenta, just the presence of a placenta, tends to stress a woman towards developing hypertension and diabetes in pregnancy. And if she's got any predisposition to those things, then she's more likely to develop those complications in pregnancy. And by being aware of those things and working with her referring provider, we can decrease the risk of things like preterm labor, bleeding disorders, and other problems that babies would have.